Hello, my name is MarkAlain Déry. I am an HIV and infectious diseases physician here in New Orleans, Louisiana. On behalf of Urban Health Today, it's really an honor and a pleasure to welcome Vatsana Chanthala, somebody who I've known for many, many years here in New Orleans, and it's a pleasure to do an interview with her talking about HIV disparities. Real quick on Vatsana, she has dedicated her life, and I can attest to that, she has dedicated her life to improving the health of those that are underserved and that are most vulnerable for over 20 years. Her passion draws from her own experience as an immigrant from Laos. She holds a master's in public health from Tulane University School of Public Health and Tropical Medicine and currently serves as the director of Ryan White Services and Resources, a division of the New Orleans Health Department, to implement HIV treatment-related services in Orleans Parish and 7 surrounding parishes as well. And as you all know, in Louisiana, we don't have counties, we have parishes. Welcome to the show, Vatsana. It's a pleasure to have you here today.
Thank you, Dr. Déry. Thanks for having me.
We are here to talk about HIV disparities, and so let's start with that question. If you could help us understand, what are HIV disparities?
So when we're talking about disparities, we're talking about differences, significant differences in something. And as it relates to HIV, we're talking about differences in different populations in being able to access both HIV prevention resources, information, and also treatment-related services. So when you have disparities, among our populations as it relates to testing, our testing rates among different populations are lower. But when in terms of diagnosis, our highest cases are among African Americans, specifically African American males, how people I guess categorized as MSMs, also followed by African American female and white MSMs. So I'm not going to say too much or quote the data, but among those who are diagnosed with HIV, while African Americans represent less than 40% of the population, the new cases and also existing cases of HIV are among African Americans. So it's really important that as we work on addressing stigma, disparities, access to care, that we really focus our attention to serving those specific populations. And the way that we do that is by making sure that resources are available. So for us in our metro area, we serve persons living with HIV in 8 different parishes, and that includes, or counties, and that includes the rural area in Orleans and Jefferson counties. So Orleans is also a city and a county. So for us, when we're looking at directing services and funding agencies, we are identifying agencies that are located in these parishes. But for some of the rural area, we've noticed that individuals with HIV are more comfortable with coming to an urban area for services because of stigma. So as we are working with our clients and our agencies in identifying resources, we want to look at what is most helpful and what would engage people in care the most. And I had mentioned services. So when we're looking at disparities, we're also identifying, what has been identifying for the area is that rent in the area has gone up significantly, much higher for our clients and everyone in general. Access to food has gotten much more difficult and food has gotten much more expensive. So as we are identifying resources and services for the area, we're identifying services such as access to rental assistance, food, so that individuals can take their meds, transportation so that they can get to a doctor, and not just medical visits, but any supporting visits, such as seeing a case manager or seeing a mental health provider that could help engage someone to get in care and stay in care. Also, and definitely access to assistance with premiums, insurance assistance. So that's co-pays, deductibles. So those are the major service categories that have really assisted clients to get linked to care and stay in care.
Yeah, that's amazing. And to be clear, that is what you run out of your office, and those are amazing services that you're able to provide through Ryan White federal funds that flow through your office that go to these agencies in these 8 different parishes slash counties here in southeastern Louisiana. Just real quick, you did bring up an interesting topic, and that is, not only do we care for people living with HIV, and we're able to provide medications. Your office provides the ability for clients or people living with HIV to be seen by physicians like myself, to or providers, able to get labs and able to get medications that really do amazing work in bringing their viral load to undetectable levels. And we'll get to that in a moment, just talking about U equals U. But you do provide significant other services, like you were just mentioning, rent services and food services as well, because what I think is important for us to recognize is that not only is it's the total care of HIV, and that total care not just includes your monthly injection or your daily medications, but also includes the living and situation, the housing situation, and in fact that makes total health essentially, and that's what your office provides to quite a number of people living with HIV here in southeastern Louisiana.
Yes. And I think when you think about HIV, you have to really treat the whole person, because HIV is a disease that touches different fabrics of our society, right? It touches the politics, it touches religion, healthcare, education. And so as we are trying to end the HIV epidemic, we have to really identify what are the different issues that impacts our clients. And that's where, and I know we'll talk about this later, is that's where our efforts in ending the HIV epidemic and Bounce to Zero comes in. But yes, you can provide food, you can provide transportation, you can provide medications, but at the end of the day, if people don't feel comfortable coming in to get care, they're not going to come in because of stigma, whether it's internalized or external. You can provide transportation, you can provide all the different resources, but people still have a fear as it relates to HIV. People still think that you can get HIV through casual contact. Or we've had clients where they've been displaced from their homes because family members found out of their status. So until we can get to a place where we can make HIV testing a normal activity when you go to the doctor's office, or routinized testing, or just having conversations about HIV, we're not going to end the HIV epidemic. So it's really important that when a clinician, if you're in primary care or in OBGYN, if a client comes in and a person asks for, hey, can I get an HIV test? Just offer it to them, because we've had a situation where clinicians would question, why do you need it? In Louisiana, it's an opt-out testing state, yet many clinicians don't implement that at their clinics and provide that as routine testing. And we know that while we know the cases of HIV in the metro area is about 8,600, we also know that at least 1,000 more do not know of their status. So it's important that to address disparities, that we routinize HIV testing, have conversations about HIV, and that includes in the faith-based community, right? Just bringing that and having that as an ongoing conversation, and also in the school system. And I think that's where more work is needed, is bringing those two areas in so that we can have honest conversations and just talk about HIV because it's no longer a death sentence, and many people think that it still is.
100%. Yeah. There are a couple things so many things that you said that are, so relevant and so wise. I mean, I think one of the things that I think as we're talking about disparities, when you said that we have about 1,000 people living with HIV who don't know their status, I'm not going to ask you about statistics, but I can kind of guesstimate that we could see disparities just in those 1,000 individuals, that we know that there's going to be a higher likelihood that those people who don't know their status are likely to be younger individuals. So there are some disparities there. Those are going to be pulling from communities of color as well. And as you said, here in Louisiana, for the most part, this is a generality that I typically use, is that we're mostly a state of 70% white people and 30% black people. Let's just kind of just really just kind of bring it down to that level. But when you look at the cases of HIV in the state of Louisiana, what you have are 70% of people living with HIV in the state are black, whereas 30% are white. Now, of course, there's other races and ethnicities mixed in there, but that's the general. And that's where we see these huge levels of disparities. And your office is doing amazing work trying to help bring that down. And as we do make these strides forward to getting to an HIV-free generation, an HIV-free world, how does stigma affect not only just the care of people living with HIV, but how does it affect the disparities that we see with people living with HIV as well?
I mean, stigma impacts everything from HIV prevention, which is where you do testing, access to PrEP medications, all the way to treatment. And I'll share with you something that a clinician has shared with us. Just last week alone, there was a question posed to medical assistant students, and one of the questions was, how do you know if someone, has HIV? And someone mentioned, well, you can tell by the way they smell. And another student stated that HIV can spread by sitting on toilet seats. We're talking about last week in Louisiana. We're not talking about a small little village in Africa or Asia. This is in our backyard, and I think it's important to remember that with all the medical advances that we've made, with all the treatments that are available and all the resources that are available, that stigma plays a significant role in people getting tested, getting in care, and staying in care. Some clients will not take their meds, especially when you think about hurricane evacuation, right? If they evacuate the family because their family members don't know that they have HIV. And so it's really important that we normalize the conversation about HIV and make sure that, testing is a normal practice. Just like when you go into a doctor's visit, you have your blood pressure checked and everything else. And I think there's also situations where many people assume that they are getting HIV test. So I think that's even more important to really think about how do we incorporate routine testing and get people in care, get them undetectable, because we know that, undetectable equals untransmittable.